Starting, right? Okay, thank you, ma'am. I don't know what um, that lady who just said that we are being recorded. I hope everyone is fine with that.
Mhm.
Um, and so yeah, so welcome everyone. It's been a fun 13 minutes starting this consultation. Yesterday the start was much more serious, I would say, and probably I should first give you an update of what kind of conversation we had yesterday, because yesterday we had a regional consultation on two issues, one being community mobilization and the other being our pilot, the TBpeople pilot of creating country chapters and mobilizing communities on the country level. So first of all, my name is Timur Abdullayev. You can see three of me on this call, but I'm the real one. The others are not. So I'm Timur Abdullayev. I'm a board member in TBpeople, which is a global network of people affected by TB. We are turning 5 years old actually in a few days, which is great. I realized it just yesterday. Yeah, I think it was crazy, but very exciting 5 years. Would be fun without COVID, I would say would be much better without COVID in past year and a half, but what can we do? So, welcome again. And let me just give you like maybe 2 minutes overview of what kind of conversation we had yesterday. So first of all, and I have to say that this conversation was inspired in a way by who started who raised the question of what actually is a community. And yesterday we tried to think how we understand community, especially because there are different ways of defining it. And one way of defining it, there are like, unfortunately, all of the ways they're all present in TB, because first of all, we have TB, which includes everyone. It includes doctors, nurses, people affected by the disease. It includes activists, includes civil society, researchers, donors doing something about TB, even private sector, and everyone who has TB, they be the global TB community. And here um, the key factor or the key criteria is basically that it's a common cause. Uh, all of these stakeholders, they are trying to, they're working on TB, and hopefully all of them are driven by an aspiration to end TB. Unfortunately, in my experience, it's not always like that. Let's pretend we believe that the TB community is all about ending TB. Then there is also a community which WHO loves using a lot in their documents, and that's usually actually the geographical communities. It's the community in the geographical sense, meaning villages, townships, neighborhoods, towns, cities. So basically, it includes everyone who lives in a, and even when we say affected communities, that means the villages which are affected, or neighborhoods affected by TB, and so on. But that's not the community we are going to discuss today. Today we are discussing the third type of community, which is community of people affected by TB. And here we have two criteria that actually unite us. One is we share a common feature of basically being personally affected by TB, whether we had TB ourselves or our close ones had TB. And we also have some very good friends who are TB activists. They were not affected by TB, but they're like very close allies. And we should also include probably in this definition people who didn't have TB, who were not affected by TB, but who are at a higher risk of TB. And I can maybe mention the Declaration of the Rights of People Affected by. Once I'm done, I will link in the chat section. That's a document which defines who are the people affected by TB. And when we say a community of TB, that's the community of these people. It's all those people who are united also by a common cause, by a common goal to end TB, to help others overcome TB. So that's kind of a brief introduction. So that's how we agreed. We understand the TB affected community on our days consultation. And now it's actually the most exciting part, which is actually we have to speak about mobilization. And mobilization, it can be defined in different ways. If you look at definition, community definition on Wikipedia, oh, it's awful. Like it's so clever that you can probably around it. It has some words that I don't even know, which means it's not a very helpful definition. So our goal today is to actually come up with a recipe, not just a definition, but we need to understand what does it take to mobilize people affected by TB, take to create and ideally a movement of people affected by TB. And we have amazing speakers today. I'm really happy that at least most of us were able to join. I still need to follow up a couple of people, but the first speaker will be Paul Sommerfeld. Paul Sommerfeld is, you're currently a chair of TB Europe Coalition, right?
That's right.
Yes. So you are also a dinosaur, if I may say so, of TB Europe Coalition, because you were there from the very beginning. When I joined TB Europe Coalition in 2011, you were there. And you were active. So actually, I'm really happy that you were able to join us. You're one of the people in TB Europe Coalition who actually did this very first but very important steps in Eastern Europe, Asia, mobilizing people affected by TB, traveling all over the region, traveling to countries. And I remember how excited you and Fanny, who was at the time the director of TB Europe Coalition, how excited you were every time you found a TB survivor who would be keen to do something. And, you know, like I still remember those, like, oh, we found Oksana in Moldova. Oh, we found Safar in Tajikistan. It was amazing really to see those reactions. But actually those were that TB Europe Coalition was doing. So Paul, can you actually share your recipe? How people affected by TB need to be mobilized and whether they can be mobilized at all? Please, Paul.
Okay, thank you, Timur. Maybe I should add I'm even more of a dinosaur than you were only focusing on my history in Tibet. But on this panel are two other people, Pervez and Austin, with whom I was on an old working group of Stop TB Partnership many years ago, before we had TBEC. So it's good to see Pervez and Austin also still active. But thank you for the introduction. For the formality, yes, I'm currently the chair of TB Europe Coalition, and I'm also the executive trustee, i.e. the guy who does the work, for a British NGO, TB Alert. I'm very happy also, Timur, that you put your feet straight into the definitional problem of what is community. So I will not have to repeat again any of that. Thank you. Basically, TB Europe Coalition is now a well set up regional body, does not claim to be active on a national basis anywhere, but it is significant across the whole of the WHO Europe region, and especially that part of the region that we refer to as Eastern Europe and Central Asia, the EECA region, EECA. Just a small bit of history from TBEC, because I think what you're saying, Timur, is that you're interested in seeing in TBEC as an example of how an organization has grown. And going back to about 2008, there had been an earlier attempt to create a Europe-wide Stop TB. It had never mind its history, it was not happy and it had died. And then in around 2008, an organization called Global Health Advocates said that they would allocate about half the time of one of their staff to tramping the corridors of the EU in Brussels and Luxembourg on behalf of a TB network. And that's what really triggered that practical assistance triggered the startup of TBEC. But initially, those of us who got involved were all Western activists. We talked about wanting to cover the whole region, but we simply didn't know anybody past the European Union boundaries to the east. Then, wickedness, we got some money from a farmer, Eli Lilly, who had a nice they were very concerned with multi-drug resistance, and they had a special program of providing funds to NGOs. And we got some money which allowed us to travel. Basically, it was set up as money for us Westerners to travel east, and then for people from the east to travel west for conferences and so on. And from that, we gradually began to have early meetings. I remember going to Kyiv in Ukraine, and then to Bucharest. And then particularly in Bucharest, very interesting interaction that I had there with a woman who's still around, though not in the NGO sector, Dr. Mishu Stefan, who said to me, look, it's very nice you guys coming from further west to chat to us. It's all very friendly, nice, but what can you actually do for us? And we weren't an organization who had any money, so we couldn't offer to hand out lots of dosh. But gradually, as we talked, what we could offer was some training. And particularly in my own case, an early part, accidental, but an early part of my professional career, I had been an interactive trainer in the management training world. And so that led to a series over the ensuing 4 or 5 years. There must have been, we must have run 15 or more of these national workshops, usually 2 days in length, focused on bringing together in that country people from civil society who either already or were interested in being involved in tuberculosis activity. That itself over time has also had a significant impact on the purposes of TBEC. When we started, we saw ourselves very much as advocates and wanting to join with people in the East in advocating for better TB care. And then gradually we realized that unlike in the West, NGOs in the East were truly embedded in situations where there was a heck of a lot of TB, and particularly multi-drug resistant TB. And the issue was not only advocacy, but getting stuck into doing real work, operational activity, supporting individuals going through the experience of the disease, and linking up such people as and when they felt the need to become involved in more general activity on TB. And so today, TBEC is not just an advocacy agent, but we're also trying to promote the value of civil society organizations in the work of TB care as a resource that national programs should use much more and pay for. Through those early visits, we began to meet people. And that you touched on, Timur. I certainly can remember being excited when I met Oksana Rukshinyanu in Moldova for the first time. You know, I and Fanny and a colleague from Romania, Christina and Ake, had gone to Moldova for a general visit. There was no particular workshop purpose. And we'd gone to this rather scruffy, dusty town north of Chisinau called Belts, went to the hospital, were taken round, and the doctor said, would you like to meet this lady who's trying to run a bit of a patient organization? And suddenly we found ourselves talking to this young woman who spoke fluent French and fluent English, sat in a very small office, trying to begin to get an organization together. That led to us and similar experiences elsewhere. We were able to organize some regional gatherings. I remember one in particular in Kyiv in 2014, so that people began to interact with each other. And secondly, it began to bring people like Oksana or Timur or Safar Naimov into networks through which they began to understand where they might find funds and access to applying for monies. We ourselves had no money, but at least we did have by that time acceptance by WHO Europe as a significant connecting point. So in other words, we had a good relationship with WHO when they set up something called a regional coordinating committee for them and civil society. It was Fanny from TBEC who was asked to be the initial chair. And that's become a bit of a habit. So I'm now the chair of that as well, at least temporarily.
Well,
today,
do you mind if I interrupt you? And because I want a very specific question.
Yeah.
Related to actually building the organizations that started from those individuals. They grew into being local networks of people affected by TB. And actually, TBpeople was started at a workshop that was co-organized by TBEC. But my question would be like, what helped create this? Like, is it you just plant seeds, you find individual people, and then you let them learn and they just build organizations? What was the experience that TBEC had in promoting the growth and proliferation of these community-led, patient-led organizations?
I would say it's a bit of both, Timur. A lot of it, part of my general message on these occasions is to say, grab opportunities. It is often serendipitous as to what opportunity comes along, and you need to grab it, even if it isn't what you've been expecting or planning for. The other side of what you're saying is, if I take, say, the case of Tajikistan, when we first met Safar Ali Naimov and his colleague Abdul Samad, they were interpreters working in a hospital. It was a hospital provided by the Indian state, and so they needed interpretation from English to Russian and Tajik. And that's what Safar and both had TB. And Safar in particular, I find really strong individual. Because he as on a purely voluntary basis, there was no money around. He started wanting to create some kind of an organization, care being given to people with TB. And he had begun to have contacts with the national trade. He was very keen when we said we'd come and do a workshop, and which we did, and that we had there a dozen or so people from organizations across Tajikistan, and that helped lead to them setting up a little later something called Stop TB Partnership Tajikistan. And that has since grown. Other people have seen it as being a valuable. It wasn't that they necessarily thought straight away they would do X, Y, and Z, but then Stop TB Partnership Global started using them as a pilot for what is now the use of the One Impact software app package for communication with people going through the disease. And so now they have become, as far as I'm aware, the premier civil society organization in the country, working with the NTP on TB matters. There are others around. There's a big USAID initiative. And it's, for me, there are certain lessons there. One is you need one or two good, energetic individuals willing to put in some time and effort. And that is much easier said than done. I know my own organization, TB Alert in the United Kingdom, we have a sort of embryonic group called, they're called TB Action Group, but because of those initials, to make themselves notice, they call themselves TBAG. And TBAG is a potentially effective network of people who have had the disease in Britain. But it has been very dependent on TB Alert being able to give the administrative time of somebody to help it happen. And without that, it hasn't happened. And so it's gone up and down with the financial vagaries of TB Alert. And right now, TB Alert is in a rather poor financial position, but we do have an energetic new person involved in TBAG, who herself is a doctor in Britain, but had TB when she was a medical student in Pakistan. And so she's medically, she's not that involved in TB. She's a specialist in another medical area, but because of her history of TB, she wants to put in some energy and to start moving things along. And so for me, so that's a starting point. There are some key individuals, and you're hearing from a couple of them in the next panel as well, when you start hearing what Olga Klimenko has been doing with TBpeople Ukraine, and Marie in Georgia. They then pull around them allies. They look for allies, and allies in two directions. One, allies in the official TB service world, the NTP. So are there individuals that they find it easy and useful and helpful and friendly to talk with, and who are interested in helping make use of a network of people with experience of the disease? And secondly, pulling together individuals who would be members of such a group, and finding in different ways, setting up opportunities to meet and talk and work out what they want to do. Because that then is also a very clear map. You need to gradually be clear about what you want to do and what you can do. So that, I know if I take the example of Ukraine, TBpeople there has become extremely involved in the training of healthcare staff, running programs about TB from the perspective of individuals who've had the disease, and helping to train doctors, nurses, and other healthcare workers. Now that's partly serendipity about what monies were available, but it's partly being clear about what they have the capacity to do as a network of people with experience of the disease in Ukraine. Well, money is always and always will be a problem, and I must have gone over my 10 minutes by now, Timur. So I will bring to a close and say money is a problem. We all have to keep advocating for the fact that at every conference you go to, grand people say civil society, wonderful, but finding money for civil society seems to be practically impossible for them, other than the Global Fund. So I would just close by saying, I hope I've hinted at a few steps you might want to take, but a big one is have good people, get out there, be active, do something, and then opportunities will appear.
Thank you, Paul. I think maybe we can close now. You heard quite extensively, but I do appreciate, I did make some notes. What you were saying also resonated with what folks were saying yesterday, because we had, Oksana couldn't join, but we had Pavel, her husband, who's her colleague in that Moldovan organization. And we had Oля yesterday as well. So basically we had a few people who are out there in the region, and they were found actually initially as one or two people in the country, and they became the center of gravity. But thank you once again. And if I may now go to a slightly different region, I would like to invite the Timur Abdullayev, who's also known as Austin Rinze Obiefuna. And he is right now my fellow board member at Stop TB Partnership, representing developing country NGOs. But he's also leading the Global Alliance, and he's in the African Coalition on TB. And I know that these organizations are doing a lot in Africa in terms of planting the seeds of community-led activism and supporting those to grow and to also get stronger. Not all of those seeds were supported by ACT and by AGA, and I will come later to that as well. But what Austin and his organizations were doing is quite outstanding. So Austin, can you maybe elaborate a bit on, first of all, what Paul was saying about like what's the approach? Start with one or two people, then you help them attract more people, you help them build the network. Is it something that you were using as your approach, or is there something else that you want to mention? Please.
Thank you, Timur, for that wonderful introduction. First of all, let me say hello again to the old folks. Paul, I can see you, and Pervez. I mean, I think we should have a time that we all can easily meet and also share certain experience that, because I really learned a lot from Paul, where being on the Stop TB Partnership ACSM. So it was something that we really did, we had passion for it. You know, we didn't have such kind of funding that floats around now, but we had passion. So we really worked hard, and we are now seeing such kind of recognition coming around us as well globally. So let me dive directly to your point, Timur. First of all, let me not deviate from the question, but let me say that in terms of community organizations, there are certain things that really drive the formation, that movement, you know. And for us in this part of the world, in Africa per se, is first of all the need. Sometimes there is need, because if you look at what are the problems, we always look at what are the problems that we need to address in order to move further, in order to do things differently, in order to achieve certain milestones. So if you look, what are the problems? We looked at the problems are some certain social determinant barriers to TB services. We look at stigma, discrimination. We look at having, people not even having the demand creation knowledge about the services that are in place. So sometimes there is the need for it. Another thing, there is an opportunity. Opportunity also, from the Global Fund that says that if you want to have a CCM, you need to have a community person, you need to have civil society around the table. So that opportunity also, brought itself as well around, within some countries as well. And also now the revolution that is coming from TBpeople. Tell me, who doesn't know TBpeople if you're working in TB in any part of the world? So it's something that is really good. And you can see that TBpeople is really springing out from different countries. And that's the revolution that we want to see in TB. That is the change that we have called from the UN high-level meeting, and we're seeing it happening now. So moving directly to your question, I have a personal testimony in terms of building community organizations, building civil society and NGOs from the scratch. Because once you identify the need, I prefer working sometimes from the results and backwards to how I get there. Because we realized that there was a need for us to have a community front. And looking at also if you really want to have that voice, because sometimes it's not about having the voice. You may have a very loud voice, but it's not a strong voice to be able to hit the target that you want. I use that example especially when there's what we call in this country Kayeye people who help people to carry things in the market when they are shopping. So they help them to lift, heavy items. These people are marginalized. They are seen as people who doesn't have a voice in the society. But when they came together, they formed a group, a union. I tell you that the president of the country actually went to seek for vote from them. They went to meet them, have a meeting with them, had press conference and all that. So sometimes I really cherish that word that's normally been attributed to Nelson Mandela, that says that if you really want to go fast, you should move alone. But if you want to go far, you should move together. So yes, in starting such community organizations, you may not need everybody to be at the same table at the same time, but we need to start small. You need to sell the idea, you need to sell the vision. The vision needs to be shared with people. You don't have to if you keep the vision within you, people will never understand where you want to really get to. And that also has to come from whether it is being identified from the need or from the opportunity that comes from, from, like I give an example like the Global Fund, or from the revolution that is happening today. So if you look at it from that point of view, you'll be able to explain the vision that is coming from that idea of having such an initiative to be able to help to drive the TB response in your country. And for me, from my own personal experience in forming the Stop TB Ghana Partnership and also the TB Voice Network, which is a very strong community organization represented on the CCM, receiving over $1 million annual funding. So that will tell you that they have really built a very strong system that is sustainable and also very consistent in all their activities and interventions. How did we start? We started very small. I knew that there was need for that. I knew we've seen a lot of stigma because of even the name that we call TB in this part of the world is stigmatized on its own. So it's a very big thing, and so we needed to address stigma from from its root, not addressing it from the top there. We needed a bottom-top way to address it. And the only way we can do that is engaging people who are directly affected with the disease. You know, and because they can tell you the true, how they feel, what the true nature of. So that is very key in doing that. And again, let us not forget that in as much as we have passion for the work that we do, nobody will fund you based on your passion. Your passion may be very strong in terms of what you do, but you need to also add some kind of professionalism in it in order to be able to attract that kind of funding that will help you to articulate your vision, because your vision can never be articulated out there without funding. You may have the best plan, once it's not implemented, you don't have a plan. So you need some kind of resources to be able to back up that plan that you have, which is very key. So the first thing is about identifying the problem, you know, having real content in terms of what is the problem, the stigma, advocacy, social mobilization, discrimination, you know, testimonies from survivors, very strong content, and sellable. You have to be marketable, because despite the fact that we speak community language, we should be professional enough to be able to articulate whatever it is, the vision, the goal that we want to set to every person, because we work with different stakeholders, different sectors. We don't just work with medical doctors. We don't just work with community organizations. We also work with private sectors. We work with businesses. We work with government who doesn't even understand the language about TB. You meet with the Ministry of Finance, Ministry of. So if they're able to understand that this is a collective fight and not a fight that is coming from a single-handed person, it makes more easier for us to be able to have a strong contribution or support coming from not just donor funding but domestic funding. I always tell people in countries that once you're able, as a community organization, to be able to attract domestic funding, it means that you have matured enough to be able to be called a community organization in the country. I know there are strong barriers, legal barriers and political barriers that prevent public sector sometimes from even funding civil society and communities. But if we're able to sell what our interventions are, because it's a complementary effort that we are doing. Let's look at it from the real sense of it. The mandate for better health, for control TB in any country is from the public sector. We complement that effort as civil society organization, and that effort that we complement is inevitably is strong. That if we are not put at the center, we will not be able to match the kind of movement that is coming from the public sector, because we need to be proactive. So that's why we've seen that people who we have presently are very passionate about the work they do. So they're able to be proactive to meet that pace. How are we seeing also the people who are coming behind us? We need to be able to sell to them that if you don't move, nobody will push you to move, but you need to really move. You need to follow up and meet that pace. If you wait for them, they will never invite you to the table. Sometimes we need to have to invite yourself to that table as well. We need look at I want to use a present example, the COVID-19 response mechanism that is being developed in this country, in Ghana. We've seen that the civil society are not part of the writing team, but we had to push and had to invite ourselves to the meeting and even paying for that participation. So if we didn't have that resources, how could we have be able to do that? So sometimes it's not only about the passion. The resources need to match that passion so that you don't get demoralized. That motivation can be able to strike you moving forward. So I think I will be able to stop here, but I have itemized certain things in terms of the recipe, identifying the problem. The problem could be from the need, from the opportunities, from the revolution that is happening. Build a good content, very strong content, which is marketable and sellable, like what we say that TB is not sexy, but make it sexy. You know, have that passion. Get people who have the passion, who can who can think out of the box, who can tell you even the wrong things, but you have to be able to know when it is wrong and when it is right. And then add professionalism to be able to attract the funding. It is very key. And we're all there to support. Well, that is why we have these regional networks to support such efforts. Thank you.
Thank you, Austin. You broke it down very well. It looks like we're getting a really great recipe. Now I actually want to turn to give the floor to somebody else who is representing an organization that I admire. I keep on telling him this again and again and again. He humbly says, I'm no longer in, but the thing is, the important part is that he was one of the people who were driving the birth of this organization, the growth of this organization, and the becoming of the organization a country organization that is probably known in the world. Arne, it's once again, I want to say that TBProof is amazing, and it's one example of how much you can achieve if you really care. But I really want to hear it from you, and please, if you could share how we're able to create such a strong organization and such a strong movement. It's not about the organizational capacity, it's really about the impact that people who see themselves part of TBProof, how much change they are bringing in terms of TB and protecting ourselves from TB. Is there a recipe that you can share, Arne? Please.
Thank you, Timur. And hello, friends and colleagues and fellow activists. Maybe you won't like everything that I have to say today, but I would say, Timur, you were warned. So what is community? Well, I'm not it. Developing countries or developing contexts, community is frequently seen as a politically correct way of referring to poor people, and specifically people that have little or no of their own individual agency. So then the thought is that poor people need to band together as community to get anything done. And this perception is deeply problematic for a lot of reasons, which we can maybe unpack later on. But it's also problematic that I'm sitting here representing an organization and talking about community in South Africa, because I'm a rich, middle-aged, privileged, white doctor, an introverted doctor with 2 European passports. So why am I talking about tuberculosis in an organization in South Africa? As you said, I tried to get out of the session because I think there are a lot of people that are more representative in our organization. But I guess it doesn't mean that I don't have any value to add, even though I didn't realize it in my first 3 decades of life. So shortly after I turned 30, my wife sent me a text message that she has a hole in her lung. And 2 days later, we heard that not only is it occupational TB, she's also a doctor, but it was multi-drug resistant TB. We were able to get the diagnosis within 48 hours because we insisted to disagree with the occupational health doctors, saying, no, we're not going to wait for cultures. We're going to get a bronchoscopy at a private hospital. We're going to do drug sensitivity. It was 10 years ago already. And we were alarmed by the disease and the diagnosis, but we thought we would get through it. And 2 months later, Deline was told, well, it's deaf or dead. And excuse my French, but we thought, WTF. That can't be an option for anyone, but never mind for rich white doctors with access to all the colleagues and all the tools and everything that modern medicine has to offer. So we tried to get through that, and through our networks, we were lucky that she got access to a new drug, very lucky. And we started talking to our colleagues about it because we were told as young medical students that we were TB proof, you can't get TB. So we just wanted to give people a heads up that's not true. And then on deeper reflection, we actually knew it not to be true. My first contact with someone who had TB was a third-year medical student when we were third-year medical students, and we were like, oh, what's wrong with her? We're not supposed to be able to get TB, but she's unlucky. And then another one in fourth year, a couple in final year. And then when we were junior doctors, my roommate's cousin was also diagnosed with TB. And for a week long, the private doctor that treated him refused to consider TB as a diagnosis. Another friend of ours was told she has lung cancer because they refused to think that a young white female doctor can have TB. So we started just to create awareness around TB. I didn't have any specific interest in it, and I certainly didn't want to become an activist. But I realized through Deline's struggles that maybe I should consider career change. And it was actually while I was looking for work that a colleague mentioned, oh, your wife had MDR TB. I was invited to the union conference, but I can't go. Would you guys would like to go and talk about that? And we went there on the invitation and the funding of another very influential activist organization, the Treatment Action Group. And Deline spoke about her experience there, and then suddenly all these doors flew open, none of which we wanted. And we wondered why there were so many opportunities suddenly for us, and why there was so little, seemingly so little that had been done for a problem that was quite clearly so large. And I've thought about this for a long time, and it's not a nice conclusion that I'm arriving at, but I think COVID is teaching us the same lessons, and it's all about privilege and systemic and medical racism. 97.6% of people that die from TB live in countries that are not white, and the majority of people that die from TB in white countries are also not white. And COVID was a major problem, and it still is, but it received all the attention because it affected privileged countries first. And now that it's affecting less privileged countries like India, South America, Africa is catching up, you have this massive discrepancy between those that have and those that don't have. And it's the same with TB. TB is preventable and treatable. So why is anyone still dying from TB? COVID is also now preventable. But if you look at in America, I saw today now, President Biden is offering free beers if you get your vaccination. In South Africa, less than 2% of people have been vaccinated. It's just disgusting, quite frankly. But here we were, two white privileged doctors being invited to go to the WHO, to Capitol Hill, to the House of Lords. I mean, just that term there, sorry, Paul, the House of Lords, to talk about a problem that happened to affect us, but we represented a minority of people that were affected. And for the first 3 years, TBproof was not an organization, it was just an accidental collaboration between 7 white doctors that had all been affected by TB in one way or the other. And we volunteered our free time, but it's easy to volunteer your time if you're being paid a massive salary and you have no debt. And everywhere we traveled, someone else was paying for us, and then also congratulating us and making us feel really good about ourselves, which isn't really the purpose of advocacy. So we really had to step back and try and achieve transformation actively. And it has to be an active process. As I said, we were 7 white doctors in our 20s when we started. I'm happy to say now that of the 7 founding members, only 1 is on the board. There are still 3 doctors on the board. At least 4 of the board members are now non-white. 3 are from other countries in South Africa, mostly female, which I think is also good. That's a more contentious topic. And all of them are still health workers, but 2 of them are not professionally trained health workers. So TBproof is still a niche organization in that it largely represents a professional group of activists, but we are trying to expand our reach and our relevance. And we make a point of it of not trying to create leaders for life. So every 3 years there are new elections and people are encouraged to rotate. So we don't want a chairperson for more than 3 years. But again, I'm not the right person to talk about this because I was there from the onset, and a lot of people still think about the Lean and Adher van Delft when they think about TB-proof, even though neither of us are on the board anymore. And that has advantages, but also disadvantages. So to reflect on the way forward, I think it's very important that we keep an open door and an open mind. And we've discussed this, Timur, about the approach that TBpeople has, and I have a massive amount of respect for you. But there's a discussion to be had about exclusivity and rules that limit entry, because half of the TB-Proof's volunteer group and most of the organization is volunteers, we're about 50, are not TB survivors per se. Take me as an example. I don't know if I'm a TB survivor. I've been living with latent TB since 2 months after my wife was diagnosed. I became sick for a while. I tried treatment for latent infection. I discontinued because of side effects. I still have TB infection. Am I a survivor? Am I a person living with TB? What's my deal? I don't pretend to understand what it's like to be told deaf or dead, or to see your own body waste away under a disease or vomit every day. I applaud people that survive TB, and I won't call myself a TB survivor for that reason, because I've not known it as even a small bit of the suffering that they went through. But similarly, I can't pretend to understand what it's like to be living with a disability, or living with a disability in a township, or being ostracized by a family, or being left by your partner. There are so many life-changing experiences that people go through because of an entirely preventable and non-specific airborne infection. So my message to those that are considering getting involved, fantastic if you're getting involved without being dragged into it, kicking and screaming like I was. And one size doesn't fit all. If you need someone that a rich, old, privileged dude at the WHO can relate to, then maybe send someone like Deline. If you want someone that can speak to a president or a vice president that chairs the South African National AIDS Council, get someone else. We are all different. We all have different experiences and values to bring. We shouldn't take ourselves too seriously on the one hand, but on the other hand, I live in a world where there is a massive discrepancy between the perception of the value that people can bring. And even amongst our own organization, and I hope they're listening, people didn't realize how powerful they were, and what capacity they have, not only to change their own lives, but the lives of millions of others. And if I can do anything apart from beating back TB in my life, it would be to help people realize that they are every bit as valuable as I was led to believe my whole life. And I would argue for a lot of reasons, a lot more valuable. Thank you.
Thank you so much, Arnie. Thank you for being frank, like you always are, and like I always remember you. We had quite a few conversations. And we kept our opinion. Sometimes I was really changing my opinion a lot listening to you, and I was questioning whether I was right in some respects. For example, the decision that we made in TBpeople, like to have this two-tier membership for those who are survivors and for those who not. Still remember me coming from HIV area, the organizations of people living with HIV. I remember a couple of people who were diagnosed HIV positive, and they turned out not to be HIV positive later on. Are they people living with HIV or not? You know, so it's just you know, having very strict rules is probably the wrong part, and we're trying just maybe. Me being a lawyer, I'm just trying to find a way of how not to have rules which are counterproductive or which are actually harmful. And I think that there is a lot of work to be done. So I myself, I look white. I'm not quite white, to be honest, but I know that I'm very privileged in my country because I have education, because I have something to eat, because when I had TB both times, I could get my treatment and I didn't die. And I was lucky to survive. I wasn't, it wasn't because, I did something right. No, it was because I had opportunity. And a lot of people, they don't have the opportunity. So thank you for bringing quite important issues to the table. And once again, thank you for you being you. I think that's maybe why people keep on coming to you. You're not in leadership position anymore, but people just know what kind of role you played in the becoming of TB proof, just like others. And I see Ingrid is here, I see Pomezi is here, and I know you guys, you're just such a nice bunch of people, but you're such a also, and that's why whatever you do, you will remain an activist. So thank you very much, Arne. Now I would like to give floor to Pervez, who is another dinosaur. One more. Pervez, it was really great to see you come back to TB activism after a little break that you took. And I would like to know what you think about mobilization, about what does it take to mobilize people affected by TB to become more than just patient, to become to start challenging, the just not being happy to be a case, or not to be happy to be seen as a contact. What does it take? What does it take to make that transformation? You were engaged in building communities, and you are engaged in building the community in Pakistan, the community of affected by TB in Pakistan. We have been discussing also doing the same in Afghanistan and in Bangladesh. And I that if we continue looking for resources, the list of countries will continue to grow. So Pervez, please, what is your recipe? How to mobilize community based on your experience and your ideas maybe you didn't have a chance to fulfill yet. Please, Pervez, the floor is yours. Your microphone.
Thank you very much, Tamur. Thank you for bringing me in this wonderful community of like-minded people. And I'm really happy to see Paul, Aston, and lot many other people who are working for a cause. And when you and one more thanks to you, like as you mentioned, I I I I must say, let me little blunt to say that I was in a mood of demobilization of myself. And this demobilization has lot many reasons and causes. We may talk maybe at another forum. This might not be the right forum to talk about. Uh, let me start uh, uh, with the decades. Like I remember I actually searched my previous emails for the last 20 years when you proposed this topic. And community engagement and community mobilization is very heart touching for me. And while searching this, I come across an email which came to me from Paul Thor. And this email came to me on May 30, 2007, almost 14 years back. And this email was forwarded by someone in Pakistan to Paul, and he was requesting a 17-year-old boy is dying because of MDR. Can you help? And Paul forwarded that email to me. And he said to me, Pervez, can you help? Can you mobilize your contact? Can you reach out to so-called influential people so who can help this young 17 years old boy who is dying of MDR? And this was the first case which brought my attention to like my more focus into the issue. And I now reflect another case, you probably know that in August 9, 2020, someone referred a similar case to me. You probably remember Hamid Abdul Hamid, and he was having the same problem. He was having multi issues affected by TB, MDR on a deathbed. And this reminded me like after 14 years, same case, same problem, same individual, referred to same person. So this was truly speaking, this was very painful. And it reminded me like I'm engaged in so-called TB activism. I never ever call myself activist. I am engaged in so-called TB activism for the last 20 years. And for the last 20 years, the change I saw probably within the individuals, but not the system. I still feel like system is still there when we started in 2000, early 2000. I still remember in early 2000, I was working with my organization in Pakistan, and I received an email. There's a community consultation, and I was approached by Treatment Action Group, and I get engaged with them. And since my engagement with Treatment Action Group, we moved. I will quickly jump into. We moved into the community task force, and this community task force was a kind of initial beginning of a great movement. Right now, we're calling a movement by TB affected people. And I had the privilege to become the first board member of Stop TB Partnership, where I represented affected TB people. At that time, we were calling TB patient and community representation. And being there, like me myself and lot many like-minded activists, we advocated a lot, and we were even still unable to convince the people who were sitting at the decision-making positions that the words, the experiences, the practices, the learning of people affected by TB are also important, which you need to integrate and reflect in all the processes from mobilization till service delivery to the monitoring and evaluation. And I still remember the words of Mario Ravigliano, this person who was the predecessor of the Lucica, when I said that WHO is responsible for saving lives of TB people, what you people are doing. And I was sitting at a board meeting as a board member. So when I raised this question, Mario looked into my eyes and said, Pervez, you are responsible to take lead on this all movement. And I cross-questioned him. I said, if I am supposed to leave that movement, what you people are doing there, what the hell you people are contributing? Are you leading the people towards death, or are you leading the people towards save their life? So it turned into a hard discussion. And whenever I was there, I don't know it's the right word to say or not, but I gave very hard time to the decision makers. And I believe if we are committed if we are fearless, if we are focused, and if we are targeting the purpose and aim we have, no one can stop us. It will be a long road to travel, but destination definitely comes. And when the destination comes, we believe results comes. And the reason basically actually saying this all process is I like whatever Paul has already said, what Austin said, what Arnie said, I echo them. And just to add into that, I always believe passion derives my purpose. And working with the TB people, for the TB people, with the TB people is my passion. And whatever I am doing, whatever I will do, I will try to help the people to save their life from a disease which is totally saving, curable, and treatable. And and just to recently, the example which I want to have, I am actually trying to bring my different points. I may be moving from here and there. It's not structured discussion because I have a lot many things to say and time is only 10 minutes. So the recent example which I have, when when we were planning to register TB people Pakistan, I come across with the experience that the big guns who have money, who have resources, who have contacts, they are least interested to develop a TB people movement. Why they are least interested? Because they know if TB people are empowered, they will question, they will ask for the accountability, and they will ask the question where this funding is going into. Where are the people who are supposed to serve for? And they are avoiding these critical questions. And when I started establishing TB People Pakistan, I reach out to all from bottom to top. I reach out to NTP, I reach out to donors, I reach out to organization, I reach out to the organization funded by the Challenge Fund, and I did not listen even a single word from them. They didn't reflect it back. As time came, I started thinking like, let's stop this bullshit. I am investing my 20 years and I am still starting from the zero. And when you propose this topic, I reflected, I started having flashback, like I am still in 2001 when we were having same discussion. What community, what mobilization, how recipe, blah, blah, blah. And after 20 years, if we are still standing at the same position, so I question myself, where are the millions and trillions of dollars are going? You remember, Timur, we are coming from the same platform. And if we try to figure it out, the so-called TB activists, we can count them on fingers. Same group are moving, same group are traveling with different locations and positions. Where our products are we able to replicate ourselves? Are we able to develop knowledgeable people who can at least understand the disease by themselves, who can work on themselves to reflect on themselves and at least manage their disease by themselves? And I completely agree with you. Transformation of the community comes within. If I am transforming myself, I can influence others. But if I am ignorant, if I don't know my disease, if I don't know the contacts, if I don't know the services, if I don't know the TB people, if I don't know the TB people programs, I will get nothing. So I first need to empower myself. And my recipe would be prepare. Prepare yourself first. Second, organize yourself. If we are not organized, we might not be achieving the result which we are supposed to, or we may achieve the result, but we may have to travel a long way. Then after organization, we need to explore the vulnerabilities which are affecting to us. Then we need to plan together. It would be advocacy, it would be movement, it would be anything, but together we can achieve more. Then we act together. Like I'm not taking the credit, but I must say that in Pakistan, if any patient or TB affected people related challenge arises, people reach out to me. And I always ask myself, why always I am approached by? Why they don't approach to others? There's a huge program. Why they don't reach to the program? And program is responsible. We are just a catalyst. We are the bridge builders. We are not the service provider. The service provider is someone else, and they are responsible. Yes, we can raise, we can ask, we can make them accountable, but we are just a limited people, a group of people. So taking action together is very important. Then we need to evaluate together whatever the process is going on. We need to be involved. And we mean, I specifically focus on the people affected by TB. If we are not involved in the monitoring and evaluation, we may not be able to part of the process. And ultimately, we need to prepare to scale up whatever the system and process is. So TBpeople Global is having a limited geographical location. We need to replicate it. We need to have more TB people, maybe global, across everywhere, nations, and then going to the downward stream. But again, I must say that up till now, we have we have two models. Model one is biological model. Model two is community empowerment model. And community empowerment model is basically transforming within. And our transformation relies on the knowledge we have. We need to be knowledgeable, we need to be resourceful, and we need to be blunt. And we should not be fearful for asking our rights. If any program or organization is providing services to us, they are not favoring us. They are giving our right, and right to health, right to life, right to survival, right to development is the basic right which everyone has to. And I must say that you are doing wonderful, and I love to be part of the you and the group. And I hope I will be able to contribute whatever the skill and knowledge I have, and to be able to be part of the process where we can save one single life. Thank you.
Thank you so much, Pervez. Thank you. And it's really great that I can see that even on all. First of all, it's not just the bunch. It's not just the usual suspects. Hande at the beginning, she unmuted herself and she introduced herself. We met just last year, and she basically just she wrote a book about her TB journey, and that's how we met. And now we're speaking about setting up TBpeople in Mongolia, and I hope that for Handa it's also interesting to be part of this, like maybe for a few others, so that they can think about how they can start a movement in their countries. And we are slightly over time, so instead of doing some kind of introduction to the second session, I will basically just very quickly say, in 2018, TBpeople was already a global network of people affected by TB. And we decided we need to do something to keep our feet on the ground, not to be flying up there just like many other global organizations, and just be them versus like people who are really on the ground. And we started a pilot because we didn't have the money to be opening branches like some organizations. We also realized that we need to maybe innovate and do something nobody has been doing before, which is we have to try something new. It turned out later that actually very similar model was used also in Africa. ACT was replicating, was doing this national chapters, and but at that time I didn't know, we didn't know. Very end of 2017, early 2018, when we started. Okay, we said we don't have the money to do anything. We do have the willingness to do something at the country level. We need representatives on the country level. We need local organizations to be our bridge, to be the bridge between the global organization, the global network, and the ground, the people who are actually the ones that that are the drivers of the change. So we came up with this model, which was the country chapter model, or as we call it, the country representation model. And very soon afterwards, we had our very first country chapter established. Accidentally, that leader who started the country chapter, she also wrote a book. That's how we met. She wrote a book about her experience, and she, when she was going to launch the book, we found out, and we decided, like, okay, we need to get in touch. We need to bring more people to the launch event, and that's how it started. Oля Klemenko, who's on this call, she was not part of the initial group of founders. She joined later, and nevertheless, I don't think, like, if you're talking to anyone external, they would think that Ola was there forever, because she just, you know, once she joined the movement, yeah, I think it's just something about DNA. You either have it or you don't. That's what makes difference between people who are activists and who are not. That's what makes the difference between people who are empathic and who are doing for something for others, and those who are not. So Ola, you are actually going to be a great bridge between two sessions, because first of all, I would love to share experience of building TBpeople Ukraine, which is now, in my personal assessment, if not the largest, then one of the largest national networks of people affected by TB globally. And it's also very young, because TBpeople Ukraine was created just 3 years ago, in 2018. And that's when we signed our very first memorandum of understanding, cooperation, and between the global network and TBpeople Ukraine. So it would be great if you could speak about how you did that. How you did that. What was your recipe of building an organization, not just an organization, but a network of people, a movement of people affected by TB in Ukraine? But then secondly, what is your experience over these 3 years? Now that we're going to turn our pilot into a system, into a model that we will need to apply routinely whenever we think about new countries that we want to support when they to create their networks. What are the things that we need to take in mind, to keep in mind when we develop that system? So please, Oля, the floor is yours.
Thank you, Timur, for your introduce. Yes, TBpeople Ukraine is only 3 years old, but today we are the largest national community, people affected tuberculosis in Ukraine, and we have office in a country, and I think 400 or plus minus members in our community, but we have some staff members, some office team which work with advocate in Ukraine. We work with One Impact in Ukraine. So TBpeople Ukraine, it's not services organization, it's advocate organization, but with One Impact, with support Johnson & Johnson, we can help people with tuberculosis who have some barriers about our experience. So firstly, it was idea, Timur, and I think my motivation, it was first motivation, it was with support Yulia Chern. It was first meeting in Bangkok, Stop TB Partnership meeting about human rights, about gender. I was only activist, volunteer, and this experience for after this meeting, I wanted have some strong organization in Ukraine, because when you have support, when you can see experience in other countries or global networks, and you understand it, why we cannot have some organization in Ukraine. So firstly, it was idea. And I think idea, it's firstly factors for mobilizations community. And another factors, it's teams, your teams. It's a partnership with another networks in Ukraine, because TBpeople Ukraine supported global networks, people who live with HIV. We try combine our efforts. I think the level of knowledge for community members or organization, and personality politics. Every organization, every national organization, TBpeople, need to have their politics, adapt for rules of in a country, not globally rules, but national rules. And the presence of these factors helps the organization to attract funding, because if organization haven't financing, organization have not chance to prove and be strong. And when organization has the capacity in increase its influence to national levels. Without financing, it's impossible. TBpeople Ukraine today have support, I think 4 or 5 donors. But not because TBpeople Ukraine, it's a great organization, not because we support another strong networks. We have our expertise. TBpeople community every day studies new politicals, some trainings for advocacy, because when people after disease, they not advocate. They only people who were affected by tuberculosis. So about some ideas for global consultation. I think countries has their, what I said before, every country's their specific details. And therefore approaches at the global level may not always be effective for national levels, for national organization. Maybe, for example, slogans to attract political attention. I will point out it is important to support country officers in developing their own priorities, because people in organization need to understand not globally global situation too, but they need support with work on the national levels, how they can work on the national levels with the support global politicals. So I think this support will help them communicate to correctly to decision makers, advocate to decision makers their priorities. Maybe perhaps we need some patronage people, some expert who, when we share globally politicals or global activities, these people can support it every country, adapt this globally idea for their country. And maybe it will be more effectively, and we can good results with more stronger countries organization. I think it's all what I can say. Maybe if we'll have questions to TBpeople Ukraine, I answer later. Thank you.
So, it was great to watch your network grow, and hopefully we will have similar experiences in other countries as well. And it's interesting that as a starting point, you said it was an idea, while previous speakers mentioned that it could be also the issue, the problem. Anyway, it's almost like I think in Bible, first there was a word. I can't remember the original English version of the Bible, but anyway, so the idea is the idea of whether, how, or what done. I think, yeah, it's indeed the first thing, and whether this idea, it has to happen in someone's head, and when it's like a lamp, this light here, it doesn't look like a lamp, it's actually sun, but yeah, but once you have this idea, it will drive you forward. And there are, before we go to the next speaker, just very quick things about the idea, how TBpeople was born. In 2014, I created a Facebook group, the Facebook Russian language Facebook group on TB, because I realized there is nothing in Russian on Facebook on TB. So I created this group, which is still out there, which is ECA TB or VTB in Russian. And almost like it was one of the first comments that we got there, a friend of mine from Ukraine, who's a person living with HIV activist, and he's also a TB survivor. He said, "Hey, Timur, are you going to create a regional network?" And I was like, not yet. So that's then 2 years I was really pregnant with the idea. And then there were opportunities. There was TB Europe Coalition, who was willing to, who that we need to have a movement of people affected by TB in our region. Then there was also Stop TB Partnership, which was able to mobilize the resources from USAID to support community development. And that, interestingly enough, back then and after that, last time my conversation happened 2 years ago, Mario Raviglioni was actually saying, no, Timur, you cannot create a movement affected by TB. No, Timur, it is impossible. How can you create? It's temporary. People get cured and they want to forget. I'm sorry, my Mario accent is wrong, but that's more or less how he was saying. Like, no, you cannot. It's not like HIV. HIV is a lifelong condition. And that's why people become activists. And in TB, people get cured and they want to move on. They want to forget. Well, I think that comment of his is just basically just making me even more passionate to prove you're wrong. Mario is a very smart person. We need to prove that he's wrong. And the second thing is, if you've seen the movie Inception, a movie by Christopher Nolan, there was this piece there when the main character is saying, like, what is the most infectious, what is the most contagious infectious thing? It's not like a quote. I'm just trying to give you the message, right? What is the most infectious thing? Is it bacteria? No, it's an idea. Once it gets into your head and it lets roots out, you will not be able to get rid of it. So this is really like, I really like the idea of the idea being the primary driver. So Olia, thank you so much for your contribution. I think that idea in your head, I think it was really, so and I hope that you will be able to do much more in this area.
Thank you, Timur, for all your support, because support for national organizations, it's much important.
Thank you, Olia. And now that you mentioned support, I actually thought that support is something that is also helping people to get mobilized and to go beyond being just a patient. We have a TBpeople member in Armenia, and she was supported by MSF, by Médecins Sans Frontières, by Doctors Without Borders, who had an program. Sorry, and they were supporting, they were encouraging her to have a blog where she was sharing her TB journey, her going through the treatment, and a success story, because she was eventually cured and she was able to go back to normal life. And with this kind of support that she was getting from MSF, she was encouraged to become more than just a patient. And I hope, and I actually believe that, yes, we do need to support each other, so that's how we will encourage others to also go beyond just being a patient and also giving to others. So, and now I would like to give floor to Mari Choheli, who is working with TBpeople in Georgia. And initially, Georgia was it's the motherland of TBpeople. That's where TBpeople was first registered. And I have this very old joke. It's now, when people are asking why Georgia, I say, because you don't have another town on earth that would start with TB. Tbilisi is the only one. So that's why TBpeople have to be in Tbilisi, have to be registered. We got registered first as a regional network in Georgia. And then as we moved on and became a global network and we got registration closer to our donors, TBpeople Georgia is now chapter. Mari, you are working on TBpeople's projects in Georgia, including the regional ones. And it's been a disaster because you had to have calls with me, with Global Network, telling you some things like how you need to do, because you're implementing a project on behalf of the Global Network. How is your experience, and what do you think could be improved in how country chapters are operating? So please, Mari, the floor is yours. We can see you, we can't hear you. And it's clearly not because you're muted, because it shows you're not muted. Technical issues again. So, Mari, maybe while trying to fix your technical issues, which happens, it's 20 21st century in 2021, when technologies are supposed to be this, yeah, and still these technical issues are happening. So Mari, if you could fix, yes, please, Mari, please try to reconnect. And in the meantime, did you reconnect already? No, okay, not yet. So when you reconnect, just write on chat. And in the meantime, I would like to go to our next speaker, Luis Cepeda Teng, who is the leader of TBpeople Philippines, and it's also just TBpeople chapter outside of Eastern Europe and Central Asia. And Louis, there for quite a few years. You were part of the same platform that Pervez was mentioning, and here you are with TBpeople, and you are driving the work of the country chapter in Philippines. What is your experience? And if there is something bad, also please share. We need to know what we're not doing right so that we can fix it now. Later, it will be more difficult. And if there are things that you actually like, well, that's also nice to hear. So please, Louis, the floor is yours.
Hello, can you hear me?
Yes, yes.
Okay, good. So, yes, same group with Pervez and you and me, and I think after that, what do you call this, enlightening that I experienced, I was able to stitch one by one the group here in the Philippines before this creation of TBpeople happened. So you invited me back, I think, to 2017 when we were in Mexico preparing for the TBHLM. And then I said, why not? And then we established the TBpeople Philippines with the group that I'm already created, and it's called back then the Coalition of Key Advocates for TB, because we're just really looking for what's the appropriate name for us. And this was also in alignment with a Korean declaration we had back in WHO when I was serving as the regional Green Light Committee to create national platforms. So I told myself, why don't we just connect that promise in Korea and
Oops.
Technical problems?
Yes. Uh-oh. Maybe it was my bad because I tried to
yes, hello?
yes, Louis, you're back. I
Okay,
was
good.
I was afraid I lost you. I tried to promote you to be a speaker. Zoom disconnected. Zoom is evil. Anyway,
So where was I? What was the last thing you heard? So hello?
I can't remember. I was so confused by you. Pervez,
So she was asking the
see your
question,
screen.
why not she can start?
Yes, again. So where was the last thing you heard?
You were speaking about the declaration.
Yes, in Korea, we had this meeting with the key affected populations here in Asia, and then WHO hosted that declaration with the Korean Institute of of Tuberculosis. And then it's just really promising that each of us who attended that would create a national platform for patient empowerment. So when you requested me to carry the name, I said, why not connect the two? So that's where I decided to continue on with the TBpeople Philippines. So I went on and I was able to do the legalization of the group, making sure that there are no names similar to TB People Philippines. And I was able to get 4 active board of directors or survivors to help me just for the legalization part. Even if they have jobs, they supported with the creation, and all of them needs to be living in the same region with me so that it'll be easier for us to do the signing of the papers. So we also did the introductions to the NTP, the PCCM, and I did the one of our targets, which is to be the representative of the community in the CCM. But according to them that time, they already chose somebody. So I had to wait. I had to just have to wait and for a while. So okay, so there. The launching of the group was on March 24, the way we agreed, and due to COVID, the launching was canceled. And at the same time, all of the other legalizations were also canceled, even the opening of the bank account. And but with the lockdown situation, we just continued on with the creation of the organization profile. We established a home-based office. We identified few survivors who can do just the administrative stuff. We created our Facebook page, website, emails of everybody. And then in June, I was able to get a very what do you call this, promising consultancy from USAID, and this was for the campaign hashtag TB Free Philippines. So there, I was able to do media work, and good that by default I'm not supposed to just uh, say the campaign, but say my group. So there, I was able to campaign my group at the same time. So after that campaign, our Facebook uh, was flooded by all of these inquiries. Turns out that they don't know, the people, Filipinos don't know where to go due to the lockdown, and they don't know where to get the tuberculosis treatment or to be able to get the right diagnosis. So we sort of went to doing that kind of service delivery for clinical inquiries. And I did my own interventions the way I was able to get the training from WHO. So I provided all of the literacies that they need. And at the same time, when I was doing all of these assistance, I told myself, why can't I just directly uh, what do you call this, get evidences and report to the National TB program? And that went on for 2.5 months until NTP said, Ms. Louie, please report to us on our technical working group. And when I reported to them, I was able to report to them 270 patients with wrongly handled cases by the service providers. So they saw the quantity that I was able to show to them, and they started to put TB People Philippines as part of the technical working group, not just part of the what do you call this, open forums. And after that, I think we were able to get a lot of invitations for all of their other monitoring and evaluation meetings, consultative meetings, the National Adaptive Plan for the COVID response. And then recently, we were able to do the TPT, the TB Preventive Treatment Lay Forum. And my group was really the star of the show. All of our handled patients were actually able to contribute to the lay forum for the preventive treatment. And then I was able to get just a week ago an invitation to be part of the Global Fund CCM C19 response. So we are now really recognized, and I think with all of the challenges of the COVID, it actually looked like a blessing because everybody looked for answers, and apparently we're there just ready to be able to provide these information to them virtually. And now we were able to get recommendations from WHO to please promote the Care TB app, from the NTP, please promote the Guide TB app. All of these digital app suites are now requested to my organization to be promoted because we are actually gaining more and more reach every day. We're able to talk to more than 20 patients just asking for what are they going to do with their situation. So all of these persons with TB that we are able to contact, evidences that the national TB program is requesting, we were able to provide. And luckily, after all of the pandemic and after I gave birth, I was able to now go out and get our corporate bank account applied for. And now we are able to propose to the grants that we have, um, specifically for our civil society empowerment. So everything is pretty good with our group. So thank you, Timur, for the invitation last year.
Thank you. Maybe just one thing. How was your being a chapter, not just being TBpeople Philippines, but being part of TBpeople Global movement? It's not TBpeople Global Network, but being part of TBpeople Global movement. How do you find that? Is it okay, or would you like to be like, nah, I think I should just do my own organization? And if you think it's good to be part of the global movements, then maybe what would you improve, if anything?
I love it. First of all, when we did the TBpeople naming, I was still part of the regional green light committee for WHO. Remember that? And when I was doing my own reaching out to the countries here in the region, they all wanted to be connected with one name. So I told myself that this might be the reason why I had to start the TBpeople in Asia Pacific, because all of them are just really waiting for directions. And when you told me about how to really make sure that the group will be able to be more effective, it's just a matter of making sure that my reach is wider than just my own national capital region here in Manila. So it's just the way I see it. All of you there are guiding me, because my being a shepherd for the rest of the Filipinos affected with the disease, it's the way it's supposed to be. I mean, I see it as a signal on even if I'm totally blind, I know that I'm doing the right direction. So thank you.
Thank you so much, Louis. Thank you. And so great that you are with us. You were our first member in Asia. I remember that. We even had a Facebook post when you joined TBpeople. And then you created the first TBpeople chapter outside of Eastern Europe and Central Asia. So you are the first in quite many ways. And maybe you should start thinking, like, what else can I do to to do something, to be once again the first in something? So thank you very much, Louis. And it's really great that you are with us and supporting our common cause and our common work. So it looks like Mari is here and her microphone works. So when she unmutes herself, she will be able to say how was experience of our country chapter in Georgia, because being quite, they had to go, you had to go through quite an interesting transformation, starting as a regional network and then becoming a country chapter. And then while being a country chapter, implementing a regional project on behalf of the global network. How was it? How was your journey? And what do you think we could change? What do you think we could improve? What would be your lessons you share? Please, Mari. No way. There is no sound again. How come? When I was sending you Facebook messages, I was hearing the dings, and now there is how is it possible at all?
Maybe she turn it, Marie. Maybe you turn it off your Zoom. I don't know.
I don't know, because when I was sending messages to Mari, and I was saying bling every time my
Try
message.
again.
Yeah, I maybe I should. Hello. You see?
No, it's impossible.
How come? Mari, I just heard the
You are
bling.
muted. You are muted. Maybe we try. I just now I try just turn on and turn off. Uh-huh.
But you heard that, right? You heard the bling.
Yeah, sure. Mari, try to turn on your microphone. Still not.
Maybe I can't even explain it.
It's something new for me.
Yes. Anyway, Mari, I will reintroduce you again later.
So maybe if you try to make Mari an organizer.
To make her a co-host.
Yeah,
Mari,
I already did. Now Mari can turn off our conference, our webinar at all.
No.
Doesn't work. Okay.
Anyway, Mari, I hope you will be able to sort out. I don't know how it is happening, because when I write to you this, we hear the bling.
It might be because the Zoom isn't authorized to access a microphone, but the Facebook messages are.
No, but the thing is, you hear the sound, right? When the message is hearing.
But are you sending it on Zoom?
No, I'm sending it on Facebook, and I hear the sound of message.
Yes, so what I think Facebook is allowed to access a computer's audio, but Zoom maybe not. So maybe she has to look at her permissions so that Zoom can access her computer or phone's microphone. So that's why you would hear one app but not the other. Although you're hearing it on Zoom, right?
But we're hearing it on Zoom, so I really don't.
That is peculiar.
That is very strange. That is, Zoom is discriminating, Mari. This is just awful.
I've had a similar experience about a month ago. It actually turned out to be a simple matter of the plug. The microphone wasn't properly plugged into the back of my PC.
Mari, can you maybe unplug and plug in your microphones? And because if I send, we hear the bling. That was exclamation point. Yeah. And interesting, yeah, Mari can hear my texts coming. She cannot speak. Anyway, too bad. That's too bad.
I still think it is a microphone, because the messages on Zoom access the phone or the laptop speakers. So that's why it activates. But if you speak into your device, you need permission to. You need either microphone isn't working or it's been disabled for Zoom. Because
Yeah,
it's
maybe.
different. A message goes straight to speakers. It doesn't have to go through the microphone.
Maybe we can hear her next time.
Maybe. Yes, we will need to organize another consultation, I guess. But yeah, that's okay. It's unfortunate, but let's move. Or should I say, another person who is supposed to speak, but then actually I don't see him joining. Stephen from Kenya, I don't think he joined. No, he didn't. Which means that we don't have another speaker. Maybe if Arnie was said the right thing, maybe Mari, you can join using the same link, not the Google Meet link, but the same Zoom link that you used to join here. Maybe if you could join from phone, that would be the solution. And in the meantime, I don't know also why Steve didn't join. we still have some time, so maybe if you allow me, I will just write to him, "Hi Steve, are you online? And then, are you joining the consultation?" And then probably just send him he will be one more Timur Abdullayev, but uh, I hope Paul doesn't mind either. Having too many Timurs Abdullayevs may be dangerous. So,
like we have this movie B. Stanley Kubrick, and now we have webinar B. Timur Abdullayev.
Pizza, if you could alert Steve, that would be nice. And Christina, maybe if you could send him the link for joining as a panelist, that would also be great, because he confirmed his participation.
Or maybe I need his email, because probably I sent it through some wrong email.
I will send you the email. In the meantime, maybe we can have a little bit of discussion around the issues that we discussed in the first and the second panels. So what are the impressions, guys? I see that nobody was posting anything on the Q&A section. There was only one comment from Wheelie from the beginning, and we still don't have any. We don't have any other questions. Usually, it means like when you don't get any questions, it means either you're doing excellent job or doing awful. So I wonder, what is our case? Is it that we're doing so great that folks are just like, we don't have any questions? Or is it like so awful that people are like, what's going on? I'm spending more than an hour on this call now. It's like 2 hours now, and I still can't make, like, what are they discussing? So I really...
It's so awful.
It's so awful. Paris, thank you. I don't even know if you were honest or if you were teasing or something else. I really don't know. Maybe it is awful. I don't know. Looking at Arne's face, Arne is very serious. He's like, yeah, it's awful.
I'm trying to multitask, and that's not easy. I'm trying to send a message.
That's what we all, I think, started learning with this COVID thing, and having, like, sometimes one skill I couldn't learn is being on 2 meetings at the same time and speaking at the same time. That's like what I couldn't do. I was able to do once. My head was literally like, my brain was leaking out of my ears. But I remember being on 2 meetings at the... I couldn't follow, of course, both, but at least I could hear when I was invited to speak, and being by background. Whenever I'm asked to speak, I'm ready to speak. It may be some crazy, stupid saying, but I will be speaking very confidently. So I think there is a politic. Like, I could make a career of a politician with that skill. But I think I'm too honest. So anyway, let's see. Mari, can you speak now? Yeah, that's interesting. If she shared the link that you're supposed to be joining using the same link. That's weird. That's really weird. Anyway, I think this is it. We will not be... I could hear the bling. It's becoming like a mania. But anyway, maybe we will be able to finish earlier, or maybe our speakers would like to add something to the topic, especially were in the first panel, maybe now you are inspired to also add something. No, no.
I would like to volunteer people, the attendees, to speak up. There are a few there that have unwisely remained on the call that are also from TBproof, who are more representative. So I'm not going to call people out by name, but maybe if they're willing to say something.
Yes, and also we have Bertrand on the call from Francophone Africa, because we didn't have, and he's doing what ACT is doing in Anglophone Africa. Draft TB that he's representing is mobilizing groups throughout the region of Francophone Africa. So Bertrand, and Bertrand is also starting a TBpeople chapter in Cameroon. So maybe Bertrand, you can say something. You're also one of the decorated TB activists. You've been around for quite some time. We met on the same platform. I think it was. We don't say that name during the call, but. Bertrand, maybe you could share your experience around community mobilization, and also the efforts so far that you've been investing into building a country chapter in Cameroon. Do you want to say something?
Yeah, Timo, thank you very much. I'm not sure I have you have my video because I'm very happy to see some whole some whole friends like Pervez who is on board, also put. Yes. So I'm really happy to join. So one of my key expectations was to make sure that someone from the TBpeople Cameroon can participate, but the meeting is only in English and they don't have opportunity to participate. Because my first introduction is that actually we succeed to implement a strong group, a strong organization of TBpeople here in Cameroon. And we receive a support from the global TBpeople, and then we succeed to implement. So maybe I don't know if maybe the next time some of those leaders, because actually it looks like we are old, and we need new blood, and this is also part of my project to make sure that we have strong advocates, strong leaders who are behind, and then so that they can support. So at first, I'm very happy to say that actually we have a functional TBpeople group here in Cameroon, led by a young lady who is also a nurse. And then the group, we provide my organization. Hello?
Yes, go ahead. I think it was someone's phone unmuted. Maybe that's why.
Okay, that was the first point, because I'm so proud of that achievement. My expectation is that maybe the next time. So, you know, my region, Francophone Africa, is look like we have some of the high burden countries in the region, for example, DFC, Central African Republic. And then it's looked like at the beginning, 10 years ago, it's looked like we have only little people who are involved, only little organization, only few organizations who are involved in terms of community engagement. So one of our dream was to make sure that maybe first in the region, we can have a strong movement who can contribute to the NCB strategy alongside with other partners. So it was one of my key personal expectations maybe 10 years ago. So actually, all our effort was to make sure that in each country we can have a civil society movement dedicated for TB, and then that we succeed to implement our regional umbrella organization with the support of you guys, with the support of Act Africa through Austin. And then you have a functional umbrella organization called RATTB in 12 countries in Western Central Africa. The journey was not easy because the first challenge was to make sure that we have first country chapter in each of these 12 countries. And you know, community movement on TB is not really so far strong. It's not really established. And then one of our methodology was when we travel in a country, maybe when I travel in a country for my personal consultation, because sometimes I'm working for Global Fund and from other technical agencies to support country in terms of community system strengthening, community TB, engaged TB. So when I travel in the country, I take that opportunity to meet with some community leaders at country level. I discuss with those country level, and I bring those leaders at country level if they can work together and form a network of TB organization. That's why we did, and we also received a lot of support from other colleagues. For example, Maxime Lunga in DRC, Edouard Kambo in Côte d'Ivoire, Fabrice Kotoko in Benin. With all those colleagues, mostly after the TB HLM, we decided normally to start our regional coalition. And then when we start our regional coalition, one of the key strategies was also to partner with NTP, because it's very important also at country level or regional level to work with the NTP, not with the national TB program. And for example, RATTB was lucky because in Western Central Africa, we have a strong network of NTP. So one of our strategies was first to make sure that we have a strong collaboration with that network, and then that network of NTP can discuss with their country members who are national TB program, so that they can really involve community organization, TB affected community, TB survivor on their national activities. And actually, in all of our 12 countries, they are really involved in TB activities at country level, working together with NTP to review the national strategic plan, working together with the NTP on a new strategic plan. Actually, they are working together with the CCM to make sure that community priority are part of the Global Fund proposal. And actually, we also have some of our members at country level who are leading the C19RM proposal to make sure that community priority, civil society priority, be affected priority are part of the Global Fund investment. So this is what we are doing now. And then the next challenge is to make also sure that maybe in most of our country, we can also have strong movement of TB survival, because actually we only have now in Cameroon, we have one in DRC, we have in Benin, and we also have 8 additional countries who is part of our next priority to make sure that we can also have movement of TB survival. So thank you so much, Simu, my friend, my brother, to give me the floor. Over.
Thank you very much. Merci beaucoup, mon frère. It's really great that you were able to join. And now that we have Stephen Glorious, I would say he is glorious for sure. When I met Steve a few years ago, this young humble guy, you know, I could not imagine that he would be the driver of the community movement in Kenya. And when I was in it was right before the COVID broke out. Peter was also there. I remember. Yes. So Steve, really great to have you with us. Steve, you created, I would say you drove the process. You led the process as a leader, as a community leader. You united folks from all parts of Kenya. And now that is called the National TB Champions Network, the network of TB champions of Kenya, right?
Yes.
Now that you are coming to the point when you get your registration certificate, we are going to this signing of memorandum of understanding, cooperation, and representation with your group, so that you officially of TB people in Kenya. So now is your chance to say about this collaboration. What is your experience so far in terms of mobilizing a tremendous job? What are the lessons learned? Maybe you can add something to the recipe. We were trying to identify a recipe of community mobilization. So what is your recipe of community mobilization? Please, Steve.
Yeah, thank you very much, Timur. Good morning, good afternoon, and good evening. I think in Kenya, the strategy was come up with and look for people that are on TB here, people that are willing to share
your audio is breaking up. Maybe you can turn off the video. I know that you are not in Nairobi now. You're somewhere in the field, which is particularly valuable that you could join. So maybe without video, the audio will be better.
Okay, Timur, can you hear me now?
Yeah, now it's much better.
Yeah, wonderful. So I'm saying that thank you very much for the opportunity to share experience that we've been having here in Kenya. I think having a realization of people that are affected with TB coming together is really a win for us, because for many years we've been left behind. We've been hearing policies, guidelines coming on board, but there were not that good engagement. But when the idea of having a network of TB champions came on board, and I think tomorrow one of the people that came on board and gave us ideas and strategies on how we can come up with a network, that was a very resourceful idea. So we came together and we went to different clinics around the country, several clinics, with help of the guys like Peter Owiti, who are very, very strong pillar of this network. And then we established the network of TB champion. And I think when we started the idea, people were thinking like, what will you guys do? Where will you get resources? And it was not easy. But with the help of TB people, I think we got the first support from the community resources. I think Paul Thorne and Timur did very well. You gave us a resource to start establishment, and you were able to in some of the few people that we had on capacity building in terms of the leadership and governance. And we came up with structures, and we said we can have a small leadership. So we've gone very far. We've done a lot of advocacy, and more people they understand now that there is a network of TB champion, and we've pushed even in the national strategic plan that is currently being implemented in the country as a component of engaging people that are affected with TB, and especially TB champion. Now we are called TB champion, not TB survivors, but TB champions, because we're championing the rights of people that are affected with TB. And I think this has given us a mileage, because even when African Coalition Against Tuberculosis heard that there is a network that is doing something here, they came on board and they said they are willing to support us, do even more. So we've been able to do advocacy in terms of financing, budget making process to ensure that wherever the discussion, the national is discussing budgets, they put aside a budget to ensure that activities toward eradicating or toward ending TB are being done. And also with, I think we won the Cochon Award. We are the newest winners on board. Thank you very much for the support that we've got from all over the team all over the world, the TB people and the global TB champions. We got this award because it was not the Kenyan award, but it was our TB community award. And the TB community, this means it's all of us globally, because we are the people that have been affected with TB and understand. So I think putting that into point of understanding is that we can come together as a people that are affected with TB in countries. We can come together. It's by giving space to share the TB experience, and opening up, because many are people that suffer with TB silently, but they don't show up because they don't have a space. But now with the network of TB champion, it's a safe space where people that are suffering from TB can come in and get support. We might not have money to give them, but we might have psychological support. We might have counseling, because within us, there are people that are experts in counseling. When they provide counseling, then adherence is good. We support adherence. We also support whenever there is a violation, somebody that has had TB and they faced violation or stigma, they are able to access justice with the help of Kelin. Kelin has come hand in to ensure that anytime we hear there is a violation somewhere, they come in, they support in terms of access to justice. Yes, I know it can take time to get justice, but at least the process and the platforms are there, and the network of TB champion is there. Is the will that everybody that has issues with TB comes on board, and then we are able to link. And I think in this year World TB Day, we did a lot, and the media used the TB champions to explain and to share experience all over the world, to say that TB is real and TB is treatable, TB is curable. I think our experiences went out there in real life, because previously the ministry or the TB program used to just pick somebody from the TB program, go and share experience. But now we've cried and we've requested for a space. Our space as people that are affected with TB, and now the media, wherever they want to engage a person that has undergone the experience of TB, they have to come through the network of TB champion to get these stories and be able to tell them, go and talk to this lady, go and talk to this man, go and talk to this child. So we're able to bring together the stories. And this year, in February, is when we launched the national network, which was very good. And we were able to pull some resources from AMREF Health Africa, and we were able to pull partners from different angles like Center for Health Solution Kenya. And even the National TB program was there to present, and we were able to tell them, we as the TB affected communities, these are some of the things that we feel like they should be priority moving forward when we are engaging the community. So I think this has given us a space, and we are going to use this space to ensure that there is more funding toward TB affected community, not only from Global Fund, not only from Stop TB Partnership, but all around. We ensure that anytime we are discussing TB, there is a voice of a TB affected community there. Nothing will be discussed about TB when the TB affected community is not on the drawing table. We will be participating in planning, implementation, and also oversight. If we are not engaged in this platform, we're not going to accept it. That is a stand that we've accepted, and we've said, moving forward, nothing for us without us. Mulika TB, Maliza TB. Thank you very much, Timor.
Thank you so much, Steve. It was really great that you were able to join and share. And it's interesting that there are two networks very rapidly growing. And I can see that there is something in common. When Olya was starting the TBpeople Ukraine, she traveled all over the country. She visited the hospitals. She met people all over the country. And she was encouraging them to actually join the movement, to become more than just recipients of health. And now I could see that that's one thing that you also did. You traveled around the country. You said that together with Peter, together with others, you were traveling around the country, going to hospitals, talking to people. And probably that's really, it takes, sometimes what it takes is one person who doesn't want to stop, who will go places, who will move mountains to realize the idea. And I'm not trying to say that other country chapters are different. We have, like right now, we have a lot of members in the global network from Philippines, and it's probably because, because someone in Philippines is really doing a job, right? And I hope that this will continue, but it's a very important lesson learned. And another thing is that I also think is an important lesson learned is that there has to be flexibility in terms of how country chapters operate. There have to be common rules, ground rules, be some common principles. But then it should be up to the country chapter. It should be up to the national network to decide whether they want to do services, they want to do advocacy, or they want to be able to juggle both. How they work, as like some of the things, they need to be fundamental, they cannot be changed. But other things, they need to be, there has to be flexibility. And another thing that we also learn is that country networks, national networks, can teach us a lot, can teach a lot. And it shouldn't be that the global network is coming and telling how to do things. No. Global network should be just a conductor for great ideas coming from the ground, the global level, and then from the global level going everywhere. Is just supporting those ideas, those practices, those projects, those initiatives to flourish in different places. So thank you so much, everyone. And I just want to say some questions coming. Peter posted a question, which is probably more a comment. Growth is the C910 RM being empathic on communities. So much technical support. Yes, I really hope that C910, the response mechanism, is going to do some good, hopefully. But yeah, the Global Fund learned how to listen to communities and made some countries listen to communities. Some countries still don't want to listen to communities, unfortunately, which we will need to bring. We do have the support of the Global Funds. We do have amazing support of Stop TB Partnership, and we have other supporters. So hopefully we will be able to achieve a lot. And as I say, in my opinion, right now we are at the stage of being a network, a global network with networks at the country level. But network, if we then we compare it to a lake. It's a lot of water, but it doesn't change a lot. But when you have a river can change everything. It's the same water, but it's moving in the same direction. And that's what's bringing a lot of change. So I really hope we will grow, we will become a movement, we will become a force that will have to be taken into account, that will not be ignored, and that at every table there will be a voice of people affected by TB, the voices of community. And it's not going to be just the voice for the sake of the voice, but that voice will have to be heard, taken into account, and maybe even drive the decisions made at those tables. So we are slightly behind the schedule, so minutes late, but I want to thank you all for being with us, for joining us. I want to thank all panelists, and I want to also thank all the participants who were with us all this time. 2.5 hours, guys, you are really amazing. So thank you so much. and hopefully we will meet again. And next time we'll have a very hard choice. Who should we invite? Because there will be so many outstanding networks. Even this time it was difficult, but I hope that next time whoever is organizing it will be a mission impossible to think how to have so many great networks, so many great organizations at one event. So thank you very much. Take care.
Thank you.
And stay healthy, guys.
Thank you, Timur.
Thank you. Okay, bye.
Please, Timur.
Thank you, Timur.
Hello, Timur.
Bye.
Goodbye.
Bye-bye.
Bye. Thank you.
До свидания.